A pandemic's a global problem, but many of the remedies and strategies for recovery have to be mapped out locally. Among the people doing that in Boston is a city councilor who's been concerned about the effects of the virus on everything from mental health and workplace safety to the needs for a safe commute to economic recovery. To tell us about those concerns is the district councilor from Allston-Brighton, Liz Breedon. Thank you very much for being with us, Councilor.
Thank you, Chris. Thank you for the invitation.
Because I want to start with the whole feel of this period for you. What's it been like?
Well, I can honestly say that this is not what I expected when I was sworn in on January 6th to be a city councillor. It's been a pretty fast-moving, rapidly changing landscape in the city and in the nation and globally. So it's certainly been a challenging time, but I'm really impressed with the level of teamwork and cross-disciplinary collaboration that's happening across the city, and it's really impressive.
Well, as far as people in the council, I think you have the deepest background in being a healthcare professional. Tell me about some of the areas that you want to focus on, I think beginning with concerns about mental health and domestic violence.
Well, in the context of what's happening here in the COVID crisis, there's so many folks, their regular routines, their regular work schedules, their regular support networks are all sort of thrown up in the air and have been just diminished and disappeared in many cases. So the mental health aspect is really of particular concern to me, not only in the sense of folks who are isolated at home, perhaps with an abuser, or they're in a situation where they have less access to their usual support networks. I'm also very concerned about the impacts on our young people, our students, our school-age students who their regular routines are totally upended as well. Many of the typical milestones and of their moving through the school system and graduating and going off to college, all those things are sort of gone, and I'm concerned about their impacts. And then again, the other area is just the immense grief that I think we're going to have to deal with. Some families have multiple losses. Even if someone dies of a heart attack or a stroke or some other cancer, other illness, all our usual strategies for dealing with a loss in the family are not there. We can't sit Shiva, we can't have wakes, we can't have a funeral mass. All those usual things that help someone work through a grief and a loss are gone. So I think we're going to see the ripple effects of this for some time to come.
One thing I've heard is that, and maybe this isn't really localized, is that reports of domestic violence now are down. It's hard for me to believe that there really is less problems with that, but what do you think is going on?
It's difficult to know because we don't have the data would say that, yeah, there are fewer reports. But in the context of what's happening now, if you're in an abusive situation in your home, your abuser might be controlling your access to your telephone and your internet access. So just because we don't hear about it doesn't mean it's not happening. And that's a big concern. And it's also a big concern in the area of child abuse because our mandated reporters are not seeing and observing these young children on a regular.
And the reporters being teachers, most likely, right?
And healthcare workers, the school nurse, the teachers, those folks are not having face-to-face contact with the students. So we don't know what's happening there.
Another concern you have is for workplace safety for people on the front lines. I guess that could include people in healthcare, but other people as well. Isn't that correct?
That's correct. Like many of us have the privilege, you and I have the privilege of working from our homes with all the strange surroundings. But so many of us have to go to work every day, and I'm particularly concerned that, access to adequate personal protective equipment has been a bit spotty in places. we've really had to advocate and push strongly to ensure that our healthcare workers, our first line responders, all of those folks who are in the front line have adequate personal protective equipment. And the other concern I have is in relation to workers' comp, that if some of these frontline workers become sick as a result of their job and exposure to the COVID-19 virus, it sort of seems obvious to me that they should be eligible for workers' compensation, and that it is an occupational acquired disease. And I'm hoping that we can establish a good standard for that as well.
Well, I know the governor recently put together a board to advise him on the shift back to economic activity, but there are public officials, people with healthcare backgrounds, but not a whole lot of focus on workplace safety. Are you worried about that?
I am worried because we just heard the incident out in Walmart in Worcester, where they've had to close the store because a large number of their employees have tested positive. Workplace safety not only affects the people who actually work in the workplace on a day-to-day basis, but if it's a front-facing or a business that interacts with the public, then it's a risk factor for the general public as well. And also, I feel that our lower paid employees are probably the most vulnerable, in the sense that they tend to be more part-time workers. They're not necessarily unionized. They don't necessarily have ways to advocate for their own health and well-being without risk of losing their jobs.
Well, recovery means not just being at work again, but commuting to work. You also want to look into how we can do that more safely. What worries you in that direction?
Well, right now the streets are looking pretty deserted. We don't see much traffic. We're anticipating, as we sort of gradually work towards going back to work, that we'll see more people out in the neighborhoods, out in the streets, walking on the sidewalks, and more traffic. I anticipate people will be a little anxious about using public transit. We have to assuage their anxieties and get people back on public transit and ensure that we have safety measures in place to limit the risk in that area. And also in terms of pedestrians and bicyclists, ensuring that we have adequate space on the sidewalks and on the roadways to do social distancing, even on the bicycle. It's an important consideration. And then folks passing each other on the sidewalks, we need to make sure that there's adequate sidewalk space to allow people to pass safely.
Well, if there's one area in Allston where I think the pandemic and the shutdowns are hitting hard, it's in the artist community. You're trying to do something to help there. What exactly is that?
Well, before we closed up and moved out of City Hall, I filed a hearing order to establish Allston as an arts district. I really feel that the artist community, the arts district, and the arts community in Allston-Brighton is a significant economic driver, and the arts community is really struggling right now. A lot of our music venues are closed down. So much of their place of work really has been curtailed. And I'm hoping that we can have a big conversation about how important the arts community will be in our ultimate recovery when we started to come out of this.
Of course, one of the other things I see in this part of Boston is the effect of what's happening with colleges and university. There's not a lot of warmth toward them sometimes. People don't like institutional expansion all that much, but with so many fewer students, maybe until maybe sometime next year, that's probably going to take a toll on the Main Street districts, isn't it?
So much of Allston-Brighton is characterized by small family-owned businesses. We have lots of really interesting ethnic restaurants, small establishments that rely a lot on the student population to support their business. So there will undoubtedly be an economic impact of a delayed return to school from our universities, which is why we have to encourage everyone else to plan to do takeout and support these businesses to try and get them through this rough patch.
Finally, is there a lesson from climate change about what we're going through right now?
Climate change is the other big challenge. I think the pandemic crisis has given us, it's a wake-up call. We need to think that of our communities as an interactive, interdependent ecology. We're all dependent on each other. And the impacts of climate change are going to be very similar to a pandemic. It's a global challenge. Pandemic is a global challenge. We can't isolate and localize and just focus on I'm all right, so the rest of you can go. We have to think of this as a problem that's facing all of us, and that we have to work together to get the best possible outcome. It's really striking to me that we have made some drastic changes, things that you wouldn't have thought possible. If somebody had told you in January that we were going to be doing what we're doing now, you wouldn't believe it, that it would have happened so quickly. I think the response to climate change demands equally radical and rapid responses to the way we do business, the way we think about our environment, and the way we take care of each other. Especially we have huge numbers in our communities who are, the numbers are indicating that the healthcare disparities are reflective of our economic inequality in our system. And we have to address that as well, so that we really build a really robust and resilient community in Boston.